Hi everybody, welcome to our next edition in osteology, and we're going to discuss and look at the pelvic bone today. And the pelvic bone, which is basically located in the pelvic girdle, and the other parts of the pelvic girdle would be the sacrum and the coccyx. So this area here, as you can see, is a pelvic girdle composed of this pelvic bone laterally on either side. So we have two pelvic bones on either side, and then we have one sacrum in the middle, and then we have the coccyx that is attached to the sacrum below. And basically, the sacrum and the coccyx are part of the axial skeleton. However, we include the pelvic bone as part of being the lower limb. So the pelvic bone, we're going to look at it in details. We're going to focus on the detailed indentations and landmarks and structures and features a bit later. But just to give you a general information is that pelvic bone is basically is a irregular shaped bone, and it resembles like a scapula. It has these flat and also kind of irregular type of protrusions that you will see a bit later. And one other thing that is important in that, so we have on either side, and that this pelvic bone is also referred to as inanimate bone, and in Latin it's os coxa. And the reason why it is referred to as inanimate bone is that it's nameless, and it doesn't have a name, because the reason for that is that it is basically formed by the union of three different individual bones, and we're going to look at that a bit later. And basically those three individual bones are pubis, or pubic bone, and ilium and ischium. The ilium is the upper part of the pelvic bone. The ischium is the lower anterior inferior part, is the pubic part of the iliac bone, and pelvic bone, sorry. And then we have the inferior posterior part, the back part, the posterior inferior part of the pelvic bone would be the ischium. So these basically three bony parts comprise the pelvic bone, or os coxa. And these three bones, in child after birth, basically there are separate bones. They are regarded as separate bones. But after puberty, they fuse with each other. And at the age of puberty, you don't see the landmarks, the line of the union of these three bones. But like I said before, puberty at childhood, these are regarded as separate bones. One of the functional aspects of the pelvic girdle is that this bony area basically transmits the weight of the axial skeleton to the lower limb. So we have the weight of the axial skeleton going down through a joint, what we call as sacroiliac joint. So sacrum basically articulates with the ilium, or the ilial part of the pelvic bone. So they form what we call a sacroiliac joint. So basically the weight is transmitted to the ilium, and from there it is transmitted to the one of the important bones of the lower limb would be the femur. So we have the hip joint formed by the acetabulum of the pelvic bone and the head of the femur. So and makes up the hip joint. So the weight is transmitted through the hip joint to the lower limb. Okay, so that's the basically the general information that you need to know about the pelvic girdle, the pelvic bone, os coxa. And so now we're going to look at the individual features and prominences and structures of the pelvic bones. Okay, let's get started now. Okay, one of the additional information that I need to give you is that in this pelvic area, as you can see, there is, well, this is the abdomen. So basically, the upper part of the pelvis lodges lower abdominal structures. Okay, so as you can see, there's a fanning of the ilium here on either side. So this carries the lower abdominal structures, like the lower large intestinal structures. So therefore, and below that, so there's a line here. We're going to look at this line here. It's an arbitrary line, but we call this a pelvic brim. So above the pelvic brim, so the area above the pelvic brim, this area here is called the false pelvis. When we talk about pelvis, basically we remember that the urinary and reproductive organs. But in false pelvis, we only have the lower part of the abdominal structures. And false pelvis is the area where the ala, where the wings of the ilium are located, above the pelvic brim. So this is the pelvic brim here. Okay, so, and this aperture here, what we see here, is the pelvic inlet. So above the pelvic inlet, this area here, what I'm talking about, this area, is the false pelvis. And false pelvis basically lodges the lower abdominal structure, which is the lower part of the, for instance, large intestine and so forth. However, below the pelvic brim, so this is the pelvic brim, below the pelvic brim, which is this, okay, which is this area, I don't know if you can see it properly, I'll show you in the other model, is the true pelvis, which is this area here, okay. And so this is the pelvic inlet, and this is the pelvic outlet. So between this inlet and outlet, in this area here, is referred to as true pelvis. And true pelvis is the area where you have the reproductive organs and the urinary organs. For instance, in reproductive, in female, you have the uterus and fallopian tube and ovaries. And in terms of urinary organs, it would be the urinary bladder. Okay, so this lodges the reproductive and urinary organs in the true pelvis. All right. So we have the false pelvis above the pelvic brim, and then we have true pelvis below the pelvic brim. And in the false pelvis, we have the lower abdominal structures reside in that area. In the true pelvis, in this area here, resides the reproductive and urinary structures in the true pelvis. Okay. And one other thing that I need to express is that the pelvic bones in the pelvis, basically, one of the important aspects of the this area in terms of females is that it actually forms the birth canal, and where the baby resides in the uterus, and the uterus gets enlarged, etc. So therefore, in terms of the pregnancy and the birth process and procedures, the female pelvic bones and the male pelvic bones differs in various characteristics. So, and we're going to look at that again. So, when you look at the male pelvis, it's like, it's smaller, especially the pelvic inlet. It's rounder and smaller. However, since this area serves as a birth canal in females, it gets larger. So the pelvic inlet, the pelvic inlet and the pelvis itself, it's larger. Okay, it's bigger. So it lodges and carries the baby in that particular area, and that sounds reasonable. And there's other important differences between male and females. We're going to get to that later on. Just basically, for now, just know that there are male and female differences between, in terms of the position and the structural nature of the pelvic bones. All right, there are differences. Another thing that is also important, we're going to look at it one by one, is that we see the muscle attachment points and ligaments that are attached to these particular areas. We're going to look at that also. And therefore, so we have two articulation that occurs in this pelvic area. So we have the sacroiliac joint here, okay, behind, and then we have the hip joint between the acetabulum of the pelvic bone and the femur. So we have a joint over here. So basically we have flexion extension of the hip. Okay, so this is the flexion and extension of the hip, right? And we can do that, and also we can do a lot of motions around the hip joint. We can do the flexion, extension. So we can also do hyperextension too, and we can abduction, adduction. So and we can do medial rotation, lateral rotation. So we can do a whole lot of motions around the ball and socket type of joint, which is the hip joint, just like the ball and socket joint of the glenohumeral joint of the upper limb. So we have a whole lot of motion going on in this particular joint too. One other thing is that we have another articulation here, which what we call as the symphysis pubis. So we have the right pelvic bone articulates at the front anteriorly to the left pelvic bone at this side here, and this side is referred as symphysis pubis. And then we have the articular cartilage between. So these are the pubic bones on either side, and they have this cartilaginous structure in between, and they form what we call as symphysis pubis. So this articulation of joint is referred to as symphysis pubis anteriorly. So these are the articulations that we see here in the pelvic girdle. Okay, so that's about it. Okay, so let's look at the individual features and structures now. Okay, thank you. Okay, so this is the pelvic bone, os coxa, inanimate bone, and basically this is the left pelvic bone. So we have two pelvic bones, and they unite with each other, and they basically form the inanimate bone, or the whole pelvis. So we have so this is how it sits on the in the human body. This is the anatomical position, and basically, like I said, it is formed by three different parts of bones that they come together, and they form this. The hip bone, the pelvic bone, and so basically these three parts are the ilium, the pubis, and ischium. Ilium is the ilium. All right, this is the superior part, and the superior part which fans out. Okay, so this part here is the ilium. The inferior part, the anterior part is the pubis, and the posterior inferior part here is the ischium. So these ilium, pubis, and ischium. So this is basically the front part, as you can see. So let's look at the back part here. So this is the back part, and this is the lateral part. So we have this round socket here at the back. Well, at the posterior lateral side, we have this socket. Okay, it's a depression, hollow socket, and this is called the acetabulum. All right. Acetabulum, and this acetabulum is important in where the head of the femur articulates with the acetabulum forming the hip joint. And so this is the back part of the pelvic bone, and this is the left pelvic bone, by the way. So what happens is that the head of the femur basically attaches. Okay, the head of the femur articulates with the acetabulum, forming the hip joint. I'm going to get to that a bit later. So this is the left part. All right. So you have the femur, okay, on the left part like this, and so it articulates on the acetabulum of the pelvic bone. All right. So if you get another the right pelvic bone, if you attach that and make a pelvic girdle, you would make like this. Okay, so basically, so we have the left pelvis over here, and then we have the right pelvis, all right, and this is the anterior inferior surface, and this is the lateral surface, and this is the posterior surface. So this is the anterior surface, anterior surface. Okay, so the reason why I'm showing this is that we have two pelvic bones on either side. Okay, so this is the acetabulum over here, where the head of the femur attaches to, all right, And basically what happens is that so this acetabulum is formed by the union of these three bones. So we have the ilium, the upper. So this is how it sits in the human body. Okay, so the upper part, the upper part, upper 2/5 is formed by the ilium. Okay, and then we have the anterior. Okay, the inferior part, the inferior posterior part is formed by the 2/5 is formed by the ischium. The anterior 1/5 is formed by the pubis. So acetabulum is formed by the union of all these three bony parts: ilium, pubis, and ischium. So ilium is at the upper part. The anterior inferior part is the pubis. The anterior posterior part here is formed by the ischium. So this here whole thing is ischium. Okay, so don't get confused. This anterior part here is pubis, while the whole posterior part here is flat. This fanned out part, and which is superior located, is the ilium. So ilium, ischium, and this part here anterior is the pubis. So basically, all these three bony parts are united in the acetabulum. So so after puberty, we don't see the limits of the union, because they basically come together. All right. So that's that. Let's go with this, because this is a little bit better. Okay, so this is the acetabulum again. This acetabulum is formed by the union. It is formed by the 2/5 of the ilium. Superiorly, the anterior inferior would be the 1/5 of pubis, and 2/5 again by the ischium. So all these three bones make up the acetabulum. So okay, so let's look at the acetabulum in detail now. The acetabulum, as you can see, like I said, this is a socket, okay, and the head of the femur attaches to it, all right, like this, like so, and they form the hip joint. Now here we have what we see here. We have the lunar surface here, as you can see. This is referred to as lunar surface, and on the lunar surface there is an articular cartilage that sits on here. And then we have a non-articular area of the acetabulum. This is referred to as acetabular fossa. So we have the lunar surface, and then we have the acetabular fossa. In acetabular fossa, there's a fat pad there. All right, there's a fat pad, and that's really important in absorbing friction and absorption, because as you can see, there's a ligament that is attached to the head of the femur. This is the fovea, and there's a ligament attached to this head from here and attaches to the fossa, the acetabular fossa. Okay, and through this ligament, there's an artery. There's a branch that supplies the head of the ligament of the head of the femur. So basically what happens is that with this weight protrusion of the head of the femur to the socket, so you have this cushion-like action of the fat pad located in this articular fossa. All right. So basically we have the lunar surface. Okay, let's repeat. Lunar surface that contains the articular cartilage, and this is with the hip joint, and the head of the femur articulates to this area. And then we have the non-articular surface, which is called the acetabular fossa, and there's a fat pad here, and there's also a ligament that is attached here to the head of the femur, and this ligament is called the ligament of the head of the femur, or ligamentum teres. No big deal about the other name, but the ligament of the head of the femur. And there's also, there's the margin of the acetabulum, as you can see, this is the margin, and there's also labrum that sits here in the margin, labrum. that also can fit the head inside the socket appropriately. So we have the labrum, and also on the external surface of the margin we have the capsular ligament that attaches to this area. There's also a ligament that attaches, so there's a notch here, as you can see. So the margin of the acetabulum, it stops here, and it has a depression here, but there's a ligament that attaches to the upper part of the margin. Okay, this is the transverse acetabular ligament, and forms a foramen here. Okay, just below that, so you have the artery that is a branch of the obturator artery. That branch, basically, like I said earlier, supplies the ligament with the head of the femur. It goes in, and this artery is really important in that it supplies the head of the femur. So if there's a low amount of blood supply to this particular area, in terms of aging, you would have a increased amount of osteoporosis, and this osteoporosis would also stimulate or elicit the activity of fracture, basically, after a certain age, due to osteoporosis and due to the insufficient amount of blood supply to this particular area. Okay, so that's acetabulum. All right, that's about acetabulum. So what else? Okay, so that's acetabulum, and then we have this obturator foramen here. Okay, this is the hole. Okay, this is obturator foramen. Where is that located? Let's look at it here. So we have the acetabulum here on the lateral side where the head of the femur fits. Just beneath that, anterior inferior to that, we have a foramen, a large foramen, which is called the obturator foramen. And basically, obturator foramen is formed by the union of these three bones. The upper part of the obturator foramen has contributions from the ilium. The upper anterior part is formed by the pubis, and the lower part, it has contributions from the ischium. So ilium, pubis, and ischium basically again forms the outer margins of the obturator foramen. But in adults, we do have, in terms of bony appearance, this is foramen, correct? But there's also a membrane that covers and closes this foramen, and this is called the obturator membrane. And if you look at it over here, as you can see, it is basically covered and closed by a membrane, what we call as the obturator membrane. Okay, this is the obturator membrane, and above the obturator foramen, there's a small hole left. All right, and there is a obturator groove. All right, just down here, there's an obturator groove, or somewhere around here. You see this here is the obturator groove. All right, the obturator groove, and it's basically located somewhere around here. Obturator groove, and obturator groove is important around about here. Is that through that we have the obturator nerve, and the obturator vessels passes through this small opening. Okay, so we have a large obturator foramen, but it's covered by the obturator membrane, but still there's a small opening, and through this groove you have the obturator nerve passing through this nerve and passing through this opening, and it passes through and then goes to the medial compartment of the thigh, and basically it innervates the structures on the medial compartment of the thigh, the obturator nerve. Okay, so that's and so that's the obturator foramen. All right. Okay, so let's look at the bones independently, one by one now. Okay, let's look at start with the ilium. So this is the ilium. All right, and again, this is also the ilium. All right, the left ilium. And this is the right ilium, left pelvic bone. Okay, so this part here is the ilium. So this is the left pelvic bone here. So, okay, so this is the left pelvic bone here. All right, and so this is the ilium, and it has the upper part and the lower part. So this is the upper part of the ilium, and basically this is the lower part of the ilium here, as you can see. Okay, this is the upper part of the ilium, this is the lower part of the ilium. All right, and basically when you look at the ilium, it's the upper part of the ilium is flat, it's widened. Okay, it has this wide and fanned out type of flat upper structure, which is this guy here. Okay, this guy here. All right, so this is the upper part and lower part, and let's look at the upper part now. The upper part of the ilium, it is formed by borders and surfaces. We're going to look at that. So first part is the upper margin. If you look at the upper margin of the ilium is this, and this is called the iliac crest. As you can see, this top part is sharp and is referred to as iliac crest. And you can feel your iliac crest in your waist. If you put your hands in your waist, okay, on either side, and it's sharp, and you can feel it, and by this ridge protrusion, and this is referred to as iliac crest. All right, and so this is the iliac crest over here on either side, left side and the right side of the upper part of the upper border of the ilium is the iliac crest. And on the iliac crest you have several muscles that are attached to this area. Okay, so there are several muscles, especially the abdominal muscles. So if you have the abdominal muscles over here, they come here and attach to the iliac crest. So we have the external abdominal, we have the internal, we have external oblique abdominal, external oblique, internal oblique, and then we have the transversus abdominis muscle. So we have three important abdominal muscles that come in and attach to the iliac crest: external oblique abdominal, internal oblique, and then we have the transverse abdominal muscle. And behind, just a little small area here, would be the latissimus dorsi muscle. So basically, iliac crest serves attachment to the abdominal muscles, which is really important, and small amount of latissimus dorsi muscle. All right. What else do we see in the iliac bone? We have spines at the front, and we have spines at the back. And this basically forms the anterior border. So the anterior border is this, and this is the posterior border. So anterior border, we have the anterior superior iliac spine, and then just below that we have the anterior inferior iliac spine. And on the posterior side we have the posterior superior iliac spine, and then we have the posterior inferior iliac spine. Basically, the iliac crest we can say that iliac crest is between the anterior superior iliac spine and posterior superior iliac spine. That's the iliac crest, anterior superior iliac spine, posterior superior iliac spine. And beneath these spines we have the inferior. So we have the anterior inferior iliac spine and then posterior inferior iliac spine. So these are basically serves attachment points for certain ligaments and muscles again, which is really important. And let's look at over here. So we have the anterior superior iliac spine here, and this is the anterior inferior iliac spine. And on the posterior side we don't see here, so we have the posterior superior and posterior inferior iliac spine. One of the important, so let's look at the anterior part now. One of the important attachments for the anterior superior iliac spine is the inguinal ligament. So inguinal ligament arises from here and then goes all the way down and attaches to the pubic tubercle, which is this. So this is the pubis, okay, and this is the pubic tubercle. So what we see here is the inguinal ligament. So this is the inguinal ligament, all right. So it attaches from the anterior superior iliac spine, goes all the way down and attaches to the pubic tubercle. This is the inguinal ligament. So this is one of the important attachment sites for the anterior superior iliac spine. And second, one of the important muscles is sartorius muscle. Sartorius muscle also serves as attachment point for the anterior superior iliac spine. The importance of the inguinal ligament is that just beneath that you have vessels and nerves passing just below that and entering the thigh region. like the femoral nerve, femoral artery, and femoral vein passes beneath this inguinal ligament, and then enters the anterior compartment of the thigh. Okay, so this is the inguinal ligament that attaches from the anterior superior iliac spine, and one other structure that attaches to this area is the sartorius muscle. Okay, and the anterior inferior iliac spine would be the rectus femoris attaches to this area here, and another ligament also attaches to this particular area. So these are basically attachment points for the muscles and the ligaments. So this is the anterior superior iliac spine and anterior inferior iliac spine, and then we have posterior superior iliac spine and posterior inferior iliac spine. And these posterior superior and inferior iliac spines are attachment points for the sacroiliac ligaments that attaches the ilium to the sacrum, somewhere around here from behind, as you can see. So the posterior superior and posterior inferior have attachment points from the it attaches the ilium to the posterior aspect of the sacrum. Okay, so this is the anterior border, and this is the posterior border of the ilium. Okay, so let's look at the and one other thing is the medial border. This is the medial border here. This is the medial border. So basically, so this is the anterior border, the posterior border. This part here is the medial border here, as you can see here. This is the medial border. And this is the medial border here. This medial border is made out of this pectineal line, arcuate line. So this is the arcuate line here, the arcuate line, all right? So this is the arcuate line here, the arcuate line. Okay, so arcuate line continues with the pectineal line, but pectineal line is part of the pubis, by the way. So the arcuate line is part of the ilium, but here we come here to the pubis now, and pectineal line is part of the pubis. So this line forms the pelvic brim. So we have the arcuate line and the pectineal line, and this basically continues with the pubic tubercle and pubic crest here. So all this arbitrary outlined line forms the pelvic aperture on either side. So this is the pelvic inlet, and is also called the pelvic brim. And this basically divides the false pelvis. Above is the false pelvis, below is the true pelvis. So above in the false pelvis, in the wings of the ilium, so we have the lower abdominal structures located in this area. Below that, below the pelvic brim, is the true pelvis, where you have the reproductive organs and the urinary organs are located inside this true pelvis. So the arcuate line and pectineal line is an important landmark for us to differentiate the true pelvis from the false pelvis. So this is basically forms the medial border. Okay, let's look at the surfaces now. So the surfaces, we have the iliac surface, and then we have the gluteal surface, and then we have the sacropelvic surface. So we have three surfaces. This is the iliac surface. It is also referred to as iliac fossa here. And basically this, we call this area we call this area as ala. Okay, ala means wing. So it looks like a wing. Okay, so it is referred to as ala of the pelvic bone. So we have two alas, all right, on either side of the pelvic bone. So this is the left ala of the ilium, and this is the right ala of the right ilium, right pelvic bone. So this is the iliac fossa of the ala, all right. So this is one surface. At the back we have the gluteal surface, and on this side, on the posterior medial side, we have the sacropelvic surface. All right. So sacropelvic surface, the iliac surface or iliac fossa, and then we have at the back here we have the gluteal surface. We have three surfaces of the ilium. All right. So we have 1, 2, and 3 surfaces. Here is the iliac fossa, all right, and basically this is a hollow impression, indentation area, we have 2/3 of this iliac fossa is occupied by an important a muscle called the iliacus muscle. So this serves attachment. 2/3 of it serves attachment for the iliacus muscle. All right. So let's go to the back now. The gluteal. Let's look at the gluteal surface. The gluteal surface is at the back here. All right. So the surface is at this side here. All right. This side. So this is the back side. The gluteal surface. Okay. At the gluteal surface. Okay. So we have this surface is at the back, the gluteal surface. So we have three important lines that you need to remember. Three gluteal lines. The posterior gluteal line, which is this. Then we have the anterior gluteal line, and then we have the inferior gluteal line. So we have three lines. So the posterior gluteal line is basically located just at the very close to the posterior superior iliac spine. Okay, so here, so this here, you don't see it properly, but there's a small ridge here. But so this serves as the posterior gluteal line here, and anterior gluteal line is very close to the tubercle. Okay, so this is basically, I forgot to tell you that this, on the pubic crest, you have these small protrusions at the back side. This is called the this is called the iliac tubercle. This is a tubercle, right? Well, this is the iliac crest, and this is the iliac tubercle here, by the way. Anyhow, so this is the posterior gluteal line, and this area here, starting from the iliac tubercle, and then goes all the way down to the greater sciatic notch. We're going to talk about this notch here. So it goes all the way to the upper part of this notch. This is the middle gluteal line, and then I'm sorry, this is the anterior gluteal line. So this is the posterior gluteal line, anterior gluteal line, and here, starting from the anterior inferior iliac spine here and going back towards this notch here, and this is the inferior gluteal line. The importance of this is that gluteal muscle attach. So posterior to this gluteal line here, okay, so this is the gluteal line, posterior to that line, this area here attaches the gluteus maximus muscle. All right, so this gluteus maximus muscle attaches here. You have the anterior gluteal line here. So the area between the anterior gluteal line and the posterior gluteal line, which this is the area here, attaches the gluteus medius muscle. All right, and then we have the area between the inferior gluteal line and the anterior gluteal line. So this is the anterior gluteal line, this is the inferior gluteal line. The area between that, so you have the attachment of the gluteus minimus muscle. Okay, so we have the gluteus maximus, gluteus medius, and then we have the gluteus minimus muscle. Gluteus maximus, gluteus medius, and gluteus minimus muscle. So these are basically the buttock muscles at the back. And these muscles are really important in extending the thigh. So these muscles are located somewhere around here. That makes the shape of your back, your buttocks here. Okay, so these are the buttocks muscle, and basically they come out and they attach to the femur, and they basically primarily they aid in extending the femur and abducting the femur, primarily gluteus maximus and medius. Minimus slightly flexes the thigh too. So these are the really important muscles that attach to the gluteal surface of the ilium, which is this surface here. So this is the gluteal surface, the back part of the ilium. Let's look at the sacropelvic surface. This area here is a sacropelvic surface. This is the back part. As you can see, you don't see it from here. Okay, so this is the back area here, as you can see. All right. So this is the back posterior aspect of the ilium, the sacropelvic surface. Sacropelvic surface. We divide sacropelvic surface in two areas. On the anterior side, we have this auricular shape, or lunar shaped. Well, this is the articular surface basically, and this is referred to as the auricular. Also refers to the auricular surface. The reason why it is referred to auricular is it resembles an ear, pinna. What we call pinna is referred to as ear, and since it resembles the ear, it is also referred to as the auricular surface. Basically, it's articular surface. Why? Because this area is smooth, and it articulates with the auricular surface of the sacrum, like so. For instance, This is the sacrum. Okay, so we have this auricular surface of the sacrum too. Okay, this is a smooth surface. This is also referred to as, this is also the articular surface, and that articulates with this area, as you can see, like so. So the auricular surface of the sacrum articulates with the auricular surface of the ilium. Very simple, like that. Okay. So forming the sacroiliac joint. So this is a sacroiliac joint. Two auricular surfaces unite and they form this particular joint here. All right, and the posterior aspect is the tuberosity. The rough part is where the ligamentous structures attach to the posterior aspect of the sacrum. And this basically stabilizes the sacroiliac joint. And the reason why, okay, so there's a lot of ligaments attached to this tuberosity, or the roughened part, the back part, and attaches to the back part of the sacrum. And the reason why is that this joint should be really strong. Why? Because this is the joint where the transmission of the weight from the axial skeleton passes to the lower limb. All right, so we have the axial skeleton. So basically, the sacrum is part of the axial skeleton. So the weight comes from the upper part, and then through the sacroiliac joint, and then goes to the pelvic bone. The weight goes to the pelvic bone. And from here, it goes to the lower extremity. So basically, the sacroiliac joint should be really one of the important and firm joints of the body where the weight is transmitted from one place to the other. Okay. So this is, okay, so basically this is the ilium, all right? So we finished the ilium basically. Okay, so we talked about the arcuate line too, all right? So arcuate line is important in forming the formation of the pelvic brim, the arcuate line over here. Okay, so this is the ilium. Then let's look at the next bone. The next bone, let's look at the next bone would be the, okay, let's look at the next bone would be the ischium. So this is the ischium, the upper part of the ischium, this is the lower part of the ischium. Or this is the upper part of the ischium, and this is the lower part of the ischium. So if you look at over here, so you have this, the upper part of the ischium, and then you have the lower part of the ischium. Okay, so this is the upper part, and this is the lower part of the ischium. Okay? So this is the upper part of the ischium. I'm sorry, this is the upper part of the ischium, and this is the lower part of the ischium. The body, we can call this the body of the ischium, and this is the lower part of the ischium. So the upper part of the ischium basically forms the acetabulum. Okay, so this is the acetabulum. It forms a 2/5 of the acetabulum, as I said earlier, and this is the posterior lateral aspect of the pelvic bone. This is the lower part of the ischium. The lower part basically forms the contribution of the obturator foramen. Okay, and this is called the ramus of the ischium. All right, so this is the body of the ischium. This is the ramus of the ischium, and the ramus of the ischium, as you can see, unites with the ramus of the pubis. We call this the superior ramus. Now we're going to look at the pubis. So this is a part of the pubis. Pubis basically, we're going to look at that. We're going to come to that a bit later. The pubis has superior ramus and the inferior ramus. All right, but here the inferior ramus of the pubis unites with the ramus of the ischium. So ischium has one ramus. However, the pubis has two rami or ramus, the superior ramus and inferior ramus. Here, inferior ramus of the pubis unites with the ramus of the pubis of the ischium, and then they call this as ischiopubic ramus, or conjoint ischiopubic ramus. So you call all this part as one, if you want to call it as one piece of nomenclature or name, is the ischiopubic ramus. This is the ischiopubic ramus, or some refers as conjoint ischiopubic ramus. All right, but it is formed by the union of the ramus of the ischium and the inferior ramus of the pubis. Just remember that. Okay, so this is the ramus of the ischium. This is the body of the ischium. All right, and if you look at the the posterior. Okay, so this is the anatomical position here. So if you look at the posterior part, okay, so this is the, okay, so this is the posterior part, as you can see, this posterior part of the ischium here. All right, we're going to look at this area here. So this is the posterior part of the ischium. This area here. So what do we see? We see a notch. So basically, this notch here is a continuation of the ilium at the posterior border. You have the posterior superior iliac spine, posterior inferior iliac spine. Then we have the notch here. Okay. Basically, this notch, as you can see here on the posterior aspect, is formed by ilium and ischium components together, and you have this notch here. Okay. So this notch is called the greater sciatic notch, and then you have the ischial spine. A protrusion, bony protrusion here. We call it is referred to as ischial spine, and below that you have another notch, and this is called the lesser sciatic notch. So we have the greater sciatic notch and the lesser sciatic notch, and in between that we have the ischial spine. All right, and these are basically part of the ischium. But the greater sciatic notch is small part of the belongs to the ilium, and the lower part, the upper part belongs to the ilium, lower part belongs to the ischium. So this is the greater sciatic notch, lesser sciatic notch, and in between that we have the ischial spine. Now this particular area is really important. The reason why it is important is that, so this is how the skeletal looks like. We have the notches here, but later on ligaments attach to certain areas, and then these notches become a foramen, as you can see here. Let's look at over here at the back. So we have the greater sciatic notch, and then we have the lesser sciatic notch. In between we have the ischial spine. Now what happens is that ligaments attaches to the from sacrum to the ischium. So we have sacrospinous ligament. This is sacrospinous ligament. Don't forget that. So it comes from the sacrum and then goes all the way down to the ischial spine and attached to the ischial spine. So with this ligament, as you can see, now this notch became a foramen. Okay, before it was the greater sciatic notch, but when the ligament united with the spine, it became a foramen, and we call this foramen as greater sciatic foramen. Now, then we have lesser sciatic notch, and again, we have another ligament called sacrotuberous ligament. And we're going to look at a bit later, but the ischium, at this part of the ischium is called ischial tuberosity, all right, this area here. So we call this ligament as sacrotuberous ligament. With this ligament, we have another foramen, and then with this foramen is referred to as lesser sciatic foramen. So we have greater sciatic foramen above, which is big, as you can see, and then we have lesser, this is the smaller one, the lesser sciatic foramen. These are really important areas. Why? Because certain structures comes out from this particular area. So this is the back of the pelvic girdle or the pelvis, and basically what happens is, like for instance, if I show you this structure here. So in adult human, right? In adult, we see. So this is over here. We have the head of the femur going down. So we have a muscle, as you can see, coming out. You see this muscle here that comes out from the greater sciatic foramen. It comes out and attaches to the femur. So this is called the piriformis muscle here. So piriformis muscle passes through the greater sciatic foramen and divides the foramen into upper part and lower part. Okay, so you have the upper part, open upper part, and then we have the open lower part. And then we call that as suprapiriform foramen, and then we call that as infrapiriform foramen. So piriformis muscle divides the greater sciatic foramen into two foramens: the suprapiriform foramen, and then we have the infrapiriform foramen. The reason why is it important? It is important because certain important structures passes through. So in the suprapiriform foramen over here, two important structures: the superior gluteal nerve and superior gluteal artery passes above the piriformis muscle here. So we have the superior gluteal nerve and the superior gluteal artery passes through. And beneath that, in the infrapiriformis or the infrapiriform foramen, we have a lot of structures that passes through here. We have the inferior gluteal nerve, we have the inferior gluteal nerve, inferior gluteal artery, and we have the sciatic nerve, which is really important. The big sciatic nerve passes beneath the piriformis muscle through the greater sciatic foramen. So we have the sciatic nerve, and we have the pudendal nerve, and internal pudendal vessel, and then we have the posterior femoral cutaneous nerve, and then we have the nerve to obturator internus, and then nerve to quadratus femoris. So we have a lot of structures that passes through the greater sciatic foramen, either above the piriformis or below the piriformis. One other important structure that we need to look at is that the obturator nerve basically comes out. It comes out from the greater sciatic foramen. Okay, it comes out from the pudendal nerve, not obturator, but pudendal nerve. So pudendal nerve comes out from the greater sciatic foramen and hooks around this ligament here, the sacrospinous ligament, and then goes back inside the pelvic cavity. This is referred to as the pudendal nerve, and then goes inside the pelvis again. All right, this is the pudendal nerve. So this is the greater sciatic foramen, and this is the lesser sciatic foramen. And through the lesser sciatic foramen, what structure passes through? The pudendal nerve, and also and then we have the tendon of the internal obturator muscle, internal obturator muscle, because there is a tendon of the obturator muscle. So this is the obturator membrane, as you know. So we have the obturator muscle, external obturator muscle attached on the external side, and we have the internal obturator muscle attached from the inside. So passing through the lesser sciatic foramen would be the tendon of the obturator internus muscle. Okay, so that's about it. So this is the greater sciatic foramen. This is the lesser sciatic foramen. And before that, what was it? It was the greater sciatic notch, the lesser sciatic notch. Okay, and then we have the sacrotuberous ligament. Okay, so we have the sacrotuberous ligament attached from the sacrum to the ischial spine, and then it forms the greater sciatic foramen. And then this is the lesser sciatic notch, just beneath the ischial spine, lesser sciatic notch. Then we have the sacrotuberous ligament attached from the sacrum to the ischial tuberosity, and what you have the formation of lesser sciatic foramen. And there's a lot of important structures that passes through these foramens. Okay, let's continue. So this is the posterior aspect of the ischium, and then we said this is the ramus of ischium. Okay, let's look at the posterior inferior aspect of the ischium, which is the ischial tuberosity, which is really important. This area here, as you can see, it's rough area. All right. Now there's the upper part and lower part. Okay, the upper part serves attachment to important muscles. And these muscles basically come from the back of the thigh, and these are the hamstring muscles that attaches to this particular area. And these are semimembranosus, semitendinosus, and the biceps femoris. These are referred to as hamstring muscles, okay, and they attach to this particular area. In the lower part, as you can see here, by the way, this ischial tuberosity is also referred to as sit bone or sitting bone, because when you sit in a really hard, rigid surface, you can feel your bone. That bone, what you feel, is basically the ischial tuberosity. So basically, you sit like so. All right. So this part here contacts with the ground. All right. So this is called the sitting bone. It was also referred to as sitting bone or sit bone. Okay. So the lower part of the ischial tuberosity, you have this fat pad located here, just to basically acts like a cushion when you sit. All right. So we have fat pad here on beneath, and the upper part of the ischial tuberosity, you have the hamstring muscle attachment point, which is semimembranosus, semitendinosus, and biceps femoris. And lateral aspect, we have the adductor magnus muscle attaches to the lateral aspect of the medial aspect. Sorry. Yeah, medial aspect would be the adductor magnus muscle attaches, and the lower part you have the fat pad that is attached to the ischial tuberosity. Okay, so this is it about ischium. Now the last part is the pubis. So the front part, as you can see, this is the pubis. So the pubic bone is the front part, the front. The anterior part of the pelvic bone is the pubis. So it forms a part of the obturator membrane, obturator foramen, and this is obturator membrane, by the way. So so we have we have two rami and the body. So this is the body here. This is the body, and then we have superior ramus and inferior ramus. Okay, this is the superior ramus, and this is the inferior ramus, and this is the body of the pubis. All right. So the inferior ramus, as I told you earlier, unites with the ramus of the ischium, forming the ischiopubic ramus below. So the inferior ramus of the pubis unites with the ramus of the ischium. All right, forming the ischiopubic ramus. And over here, and this is the superior ramus here. Now, superior ramus, we have this line here, which is this is pecten pubis or pectineal line, as you can see. Now, pectineal line continues with the iliopubic eminence. This is the iliopubic eminence. Eminence, a small protrusion of bone, as you can see here. So this is the eminence, the iliopubic eminence. But in terms of line, so we have the pectineal line. Pectineal line is also referred as pecten pubis. Okay, this is the line here. It continues with the arcuate line at the back. So in the front, you have the pecten pubis. Basically, pecten pubis goes and continues with this tubercle here. Okay, this is the pubic tubercle, and at the front we have the pubic crest. So we have the pubic crest at the front, and then pubic crest just beneath the pubic crest in front. We have the symphysial surface. We have the pubic symphysis attachment here. So we have the pubic crest, and then we go laterally to the pubic tubercle, and then we go to the pectineal line or pecten pubis, and then backwards we have over here we have the iliopectineal eminence, and then at the back we have the arcuate line. So all this basically forms the pelvic brim, or the line that differentiates between the false pelvis and the true pelvis. Let's look at over here, as you can see here. So this is the left pelvis and this is the right pelvis, and they attach on the anterior aspect with the symphysis pubis. We have the cartilaginous type of attachment here, synovial joint, and so this is symphysis pubis. All right. So this is the pubic crest. This is the pubic tubercle, and then goes backwards towards. This is the pectineal line. All right. This is the pectineal line or pecten pubis, and this is the iliopectineal eminence, by the way here. And then this pectineal line continues backwards as the arcuate line, and then goes in front of the sacrum. So this line makes up the pelvic brim, and differentiates. The upper part would be the false pelvis, and the lower part would be the true pelvis. Okay, so at the front, as you can see, this pubic tubercle serves attachment to the ingulum ligament, like I told you earlier. So we have the superior attachment of the ingulum ligament, as you can see over here, will be anterior superior iliac spine, and goes all the way down to the pubic tubercle here. Okay, and the pubic tubercle and pubic crest serve as attachment to the anterior abdominal muscles, like the rectus femoris, rectus muscle, the attachment of the rectus sheath. Okay, the anterior abdominal muscle also attaches to the pubic crest. So, and this, like I said, this is the symphysis pubis. This is where the cartilage attaches in. You see the articulation of both of pubic bones via the symphysis pubis at the front. Okay. So that's the pubic bones. I think I covered most of the things that I wanted to cover. And I think that's about it, yeah. Okay. Let's just look at this for a minute. So we have these ligaments in the hip joint. We have the iliofemoral ligament. So we have three limbs: iliofemoral. This is the iliofemoral, and this is the pubofemoral. Okay, and at the back here we have this is the ischiofemoral ligament. So we have the ischiofemoral, we have the iliofemoral, and then we have the pubofemoral ligaments. Basically, as you can see, these are acting on attaching the pelvic bone to the femur in a circular way. Okay, and then we have the obturator membrane here, and okay, we have this is the articular cartilage here. This is the head of the femur, but you see the articular cartilage and the head of the femur, and then we have the ligament of the head of the femur. Okay, this is the ligament of the head of the femur attaching to the articular fossa, and also transverse articular ligament. So transverse articular ligament basically also merges with the head of the ligament of the head of the femur. Okay, that's about it, I think. Okay, so I think we covered everything. Those the pelvic bones are really quite intricate and irregular. So there's a lot of structures and protrusions, and then a lot of attachments on this particular bone, the os coxa. So it is not easy. It's very difficult, but the whole thing is really important in terms of it's an important area that lodges the pelvic organs and pelvic structures, and that's why clinically it's important. And the apertures, we're gonna look at those in the reproductive committee, how the males and female pelvic bones differ from each other in terms of birth of the female, of the baby in the female uterus. Okay, I think that's about it. Thank you very much for listening. So this is the end of the pelvic bone, and hope to see you in our next episode of osteology. Thank you very much. Bye bye.